the cardiology section from first aid. Uh, Cardiovascular embryology, heart morphogenesis. Heart is the first functional organ in the embryos that is formed, beats by week 4. Um, Cardiac looping, primary heart tube loops to establish left right polarity begins in the week 4 of development. Defect in the left right dynein, which is involved in the left right asymmetry, can lead to dextrocardia as seen in Cartagena syndrome. Once again, heart morphogenesis, first functional organ in the embryos, beats by week 4. Cardiac looping, primary heart tube loops left right polarity begins in week 4 of development. Defect in the left-right dynein involved in the left-right asymmetry can lead to dextrocardia as seen in Cartagena syndrome. Now, septation of the chambers. Area. Septum primum grows toward endocardial cushions, nerving ostium primum. Ostium secundum forms in the septum primum. Due to cell death, ostium primum regresses. Septum secundum develops on the right side of the septum primum is ostium secundum maintains right to left shunt. Septum secundum expands and covers most of the ostium secundum. The residual foramen is the foramen ovale. A remaining portion of the septum primum forms the one-way wall of the foramen ovale. Septum primum closes against septum secundum, sealing the foramen ovale soon after birth because of increased left atrial pressure and decreased right atrial pressure. Septum secundum and septum primum fuse during infancy or early childhood, forming the atrial septum. Parent foramen ovale, that is, failure of septum primum and septum secundum to fuse after birth, seen in 25% of population. Most are asymptomatic and remain undetected. Can lead to paradoxical emboli, venous thromboemboli entering the systemic arterial circulation through right to left shunt, as can occur in ASD. Okay, septum primum from above to downward. Okay, then we have the pore, that is ostium primum, right, from right atria to left atria. Then we have dorsal endocardial cushion. Okay, then in the second there is ostium secundum. uh, we have septum primum in which the ostium secundum is formed, and also we had the remaining ostium primum. Okay, then in the third developing septum secundum, which is to the right side of the septum primum, ostium secundum is formed in the septum primum. In fourth, uh, we have septum secundum on the right side, right, that is increased, and we have uh, septum primum. These two came close. uh, Ostium secundum is there. When the septum secundum and septum primum they come close, there is a foramen that is formed, that is foramen ovale, and we also have septum secundum. Then we have foramen ovale that is being closed, degenerating septum primum. Let us see it again. Okay, atria. Septum primum grows toward endocardial cushions, narrowing ostium primum. Right? Ostium secundum forms in septum primum. Due to cell death, ostium primum regresses. Septum secundum develops on the right side of the septum primum. As ostium secundum maintains right to left shunt, septum secundum expands and covers most of the ostium secundum. The residual foramen is the foramen veil. Remaining portion of the septum primum forms the one-way wall of the foramen veil. Septum primum closes against septum secundum, sealing the foramen veil soon after birth because of increased left atrial pressure and decreased right atrial pressure. Septum secundum and septum primum fuse during infancy or early childhood, forming the atrial septum. Then we have patent foramen veil, failure of septum primum and septum secundum to fuse after birth, seen in 25% of population. Most are asymptomatic and remain undetected, can lead to paradoxical emboli, venous thromboemboli entering the systemic arterial circulation through right to left shunt, as can occur in ASD. Okay, then we have ventricles. Muscular interventricular septum is first formed. Opening is called interventricular foramen, just like in atria, interatrial foramen. That was foramen ovale. Then aorticopulmonary septum rotates and fuses with that muscular ventricular septum that will form membranous interventricular septum, closing interventricular foramen. Closing interventricular foramen. Growth of endocardial cushions separates atria from ventricles. Growth of endocardial cushions separates atria from ventricles and contributes to both atrial separation and membranous portion of the interventricular septum. In VSD, VSD is the most common congenital cardiac anomaly, usually occurs in the membranous septum. So in the first, we have interventricular foramen. Then we have atrioventricular canals. Right over here, they are talking about this thing. This is interventricular foramen. Then these are canals, right? So atrioventricular canals. Below is, they are talking about this one. Below is muscular interventricular septum, and in second we have aorticopulmonary septum that will rotates, right? Then in third, the membranous interventricular septum will form. Outflow tract formation. Neural crest cells migrations, truncal and bulbar ridges spiral and fuse to form aorticopulmonary septum that will lead to ascending aorta and pulmonary trunk. Conotruncal abnormalities are associated with failure of neural crest cells to migrate. Okay. Transposition of great arteries, tetralogy of Fallot, persistent truncus arteriosus. Once again, neural crest cell migration, truncal and bulbar ridges that spiral and fuse to form aorticopulmonary septum, ascending aorta and pulmonary trunk. Conotruncal abnormalities associated with failure of neural crest cells to migrate that will lead to transposition of great. Examples are transposition of great arteries, tetralogy of Fallot, persistent truncus arteriosus. Valve development. Aortic and pulmonary wall are derived from endocardial cushions of the outflow tract, while mitral and tricuspid walls are derived from the fused endocardial cushions of the AV canal. Once again, aortic and pulmonary walls are derived from endocardial cushions of outflow tract, while mitral and tricuspid walls are derived from fused endocardial cushions of the AV canal. Valvular abnormalities may be stenotic, regurgitant, atretic, that is tricuspid atresia, are displaced, that is Epstein anomaly. Once again, they might be of stenotic, regurgitant, atretic, that is tricuspid atresia, displaced, for example, Epstein anomaly.